Good morning, Fort Worth. I'm Corey Logan.
And I'm Kagan Miller, and this is the Daily Scrub.
Today's topic is Clostridium Difficile, and how this dangerous organism can be easily prevented by all you med-surg and ICU nurses. So, tell us, Kagan, what is C. diff?
Well, Corey, according to our source at the CDC, C. diff is a gram-negative bacteria that causes about 90% of pseudomembranous colitis, which is an inflammatory condition of the colon. This condition can lead to megacolon, sepsis, and even death. Doctors say that patients exposed to high doses of oral broad-spectrum antibiotics for long periods of time are at greatest risk for C. diff. Other risk factors include advanced age, those who are immunosuppressed, and the use of antidepressants, proton pump inhibitors, and even nasogastric tubes. In hospitals throughout the United States, as many as 3 million cases of diarrhea linked to C. diff are reported per year. Diarrhea caused by C. diff is also associated with about 14,000 deaths annually. Those are some shocking numbers, Corey, and unfortunately, the prevalence of C. diff has risen and continues to rise.
Wow, thanks, Kagan. Patients with C. diff infection may present with multiple symptoms, which may include moderate watery diarrhea, abdominal cramping, unexplained weight loss, general malaise, and of course, fever. These symptoms may not appear for up to 10 weeks after completing antibiotic therapy. It's also obvious how these symptoms tend to mimic other disease processes, such as Crohn's disease, irritable bowel syndrome, and of course, Vibrio infections. So I would think that collecting a thorough patient history is definitely a must. Now, in addition to colitis, toxic megacolon, as mentioned earlier, C. diff infection may even lead to kidney failure due to dehydration from diarrhea. In rare cases, bowel perforation may also result to damage the lining of the large intestine. The CDC also wants our ears to know that there is a difference between infection and colonization. Patients who present with clinical symptoms and test positive for the organism or its toxins are classified as having the infection. Patients classified as having C. diff colonization will still test positive for the organism or its toxins, but they will not exhibit any clinical symptoms. This, according to CDC officials, is much more common than those with the infection. Quite a scary thought, wouldn't you say so, Kagan?
That it is, Corey, that it is. Unfortunately, C. diff has become a problem in local hospitals here in Fort Worth. And special correspondent Simon Ordonez is at ABC Hospital with more on this story. Simon?
Thanks, Kagan. I'm here at ABC Hospital where a recent outbreak of C. diff has recently taken place. We have 2 women who have come forward to share their experiences here at ABC Hospital. So I'm here with Angel. Her mom, Karen, is a patient here in the ICU. Why don't you tell us a little bit about her experience?
My mom is 65 and she's been really sick for the last several years. First she found out she had diabetes, so they put her on some medications to get that under control. And she seemed to be doing okay, but then she was diagnosed with breast cancer. So last year she ended up having a double mastectomy, and then last month she finished her last round of chemotherapy. We thought she was pulling through without any complications, and then she got some kind of respiratory infection. So I took her to the doctor, they put her on some antibiotics, and she just wasn't getting better. So they said it must have been a virus or the flu. But then she started having respiratory distress or trouble breathing, so I took her into the ER, and that's when they ended up admitting her to the ICU. And she had a severe case of pneumonia and the respiratory distress. So they put her on more antibiotics, and she finally started to get better after a couple of days.
So it sounds like she was on her way to recovery. What happened next?
Well, the nurses were great about taking care of her, keeping everything clean and monitoring her condition. But then they noticed she was starting to have diarrhea that had a foul smell. So they reported it to the physician right away. He ordered some tests. They found out it was C. diff, and she was started on treatment immediately. The doctor said if the nurse didn't catch it so soon, it could have been fatal considering her condition.
Overall, it sounds like your mother had a good experience with the care she received here and is happy with the outcome.
Definitely. We're really happy with the care she received. I've heard of a lot of stories where they didn't have a good outcome with similar situations. So we're happy that we had such good nurses taking care of her, and very happy with the care we received in this ICU.
It sounds like if the healthcare team communicates and takes the proper precautions, C. diff can be managed or even prevented. Thank you, Angel, for sharing your experience with the Daily Scrub. Our next story shows what happens when precautions are not taken. Melanie Morgan is a 78-year-old Caucasian female that presented to her local clinic complaining of diarrhea, abdominal pain, and nausea. She has been a resident in a nursing home since she lost her husband last year. She has a history of hypertension, osteoporosis, and diabetes. Her dilemma began with a recent sinus infection that was treated with Keflex a week prior to her symptoms. She noticed she had an upset stomach while on Keflex, but the nursing staff at the nursing facility blamed it on her diabetes and treated her with kaopectate. While she was overcoming her troubles, Miss Morgan unfortunately fractured a hip and needed to have hip replacement surgery. After her surgery here at ABC Hospital, the staff was overwhelmed and seemed rarely to wash their hands before touching Miss Morgan. Her GI problems did not improve with over-the-counter anti-diarrheal and continued to worsen with accompanying abdominal pain, nausea, and vomiting. 2 days later, she developed voluminous, foul-smelling diarrhea. Physical examination was remarkable for tachycardia and severe abdominal pain left greater than right. She did not have any rebound tenderness, guarding, or rigidity. Routine lab testing was remarkable for white blood cell count just over 25,000, with 80% neutrophils and bands, a normal lactate, and a normal creatinine. A stool sample was sent for enzyme immunoassay. Testing was positive for C. difficile toxin. CT scan of the abdomen and pelvis was remarkable for markedly edematous large bowel wall with mucosal enhancement indicating pancreatitis. She was admitted for intravenous hydration in oral vancomycin, 125 mg 4 times a day. An abdomen series was remarkable for colonic wall thumb printing, consistent with colitis. Intravenous metronidazole, 500 mg every 8 hours, was added to her regimen. Over the next 5 days, her symptoms improved with resolution of her diarrhea. The metronidazole was stopped and she continued on oral vancomycin. Hi, good morning, Miss Morgan. So tell me, how did your experience make you feel?
Well, I just wanted this nightmare to be over, son. Thanks for having me. You know, if I had a PA, she would have washed her hands. I had those damn nurses that never wash their hands. I thought I was just going in for a hip replacement, and I dealt with the bloody shirts all the time, and I smelled like a dang horse, and just the flatulence and everything. I don't understand. Hey, you're going in for a hip replacement and you're sharding all over the place. And they don't apologize. They yell at you because you're old. I didn't get these white hairs for no reason. You know?
I'm so sorry to hear that. It sounds like an awful experience. Corey, back to you.
Thank you, Simon. What an unfortunate story. Now to Quan Trong with The Scrub Down.
Thank you, Corey. On today's segment of the Scrub Down, we have Dr. Dallas, a specialist in the field of microbiology and disease prevention. Welcome to the Daily Show, Dr. Dallas.
Thank you for having me.
All right, so today we learned that C. diff is spread throughout the med-surg and ICU units. Do you have any methods that nurses working on these in these areas can prevent the spread of C. diff?
Well, I think the first thing that we need to tackle is that C. diff it cannot be killed by alcohol. You have to wash your hands with soap and water to wash off the spores and the microbacteria. What will kill it will be bleach or sodium hypochlorite, but you can't use bleach on your hands all the time, every day. Right, so bleach the floors, bleach everything else in the room, but don't bleach your hands. Another great way to prevent spread is by trying to not have any contact with the infectious agent at all. So use gloves, gown, eye protection, anything like that.
Some basic hygiene rules.
Right.
Okay, so what about what is secondary prevention techniques then?
So the screening techniques that we use are enzyme immunoassays. There's good points and bad points about these. The good points are that they're fast and they're cheap, which is what we look for in a screening exam. The bad thing about them is that the sensitivity and specificity really aren't there, not where we want them to be. So the sensitivity is about 60 to 80%. Specificity, depending on which assay you're using, is about 90%, somewhere in the 90s. Another thing that we can use are fecal stools. So what you the good things about them are that they're more specific and sensitive. Bad points is that they're not as cheap and they take a long time to run.
Okay, so for this, what do they do with the stool, or how do they test it?
It's a culture. Another great thing that we do is direct visualization from either a sigmoidoscopy, a colonoscopy, Another thing that you want to do with the enzymes, the assays, is make sure that the patient that you're testing is symptomatic. You don't want to test asymptomatic people because there's a lot of false positives and negatives with these tests.
Gotcha. So it'll be like a big waste of money and time.
Exactly.
Okay.
Right.
So what is tertiary prevention methods then?
All right, so the first thing that we'll talk about with this is how this disease, C. diff, can spread and how it flourishes. And the second thing that we'll talk about is how to treat it. So how does C. diff spread? Well, it starts out, you come into contact with one of the toxins. The C. diff needs toxins A and B, which we assay. That's the thing that we assay. So it needs to have it needs to be competent, as we like to call it. So
it needs to have the viral component.
Right, the components for it. It needs to have the plasmids. So the next thing that we go for is the organism. It spreads. It's opportunistic. So what happens is the spores will contaminate your gut flora, and then you'll use either an anaerobic or a broad spectrum antibiotic, which will clear out most of what's in your gut. Most of your gut flora is anaerobic, and so that all dies off. That'll also kill off the C. diff, but it won't kill off the spores. So then the C. diff spores start flourishing, and that's how it spreds, and that's how it'll infect.
Can you give me an example of like a something that will kill off the gut flora?
Well, the big one that's particular is clindamycin, and it has to specifically be PO or oral clindamycin or any broad antibiotic. If it's IV, then it's obviously not going to go through your gut.
Right.
It's just going to be systemic.
Okay.
Okay. So likewise, that's how you treat it. You want an oral vancomycin or flagyl, and that will. Those are the two antibiotics that are specifically that C. diff is still sensitive to.
Okay.
Right. I have a lot of other information in the brochure that we published. And that's about all I have, I think.
All right, that's all the time we have today on the Daily Scrub Down. This brochure is also available on our online site at thedailyscrubdown.com. Thank you a lot, Dr. Dallas,
thanks for having me.
us. And back to you, Corey and Kagan.
Thank you, Quan. That's all we have today for the Daily Scrub. Stay tuned tomorrow for a refresher on proper venipuncture technique. And as always, stay fresh, Funky Town.